Imagine seeing a newborn foal, just moments old, trying to get its legs under it. It's always this moment of vulnerability, really beautiful. But then as you're watching, something seems off. His coat has this strange, almost silvery gray color, not what you'd expect. And the struggle to stand, it gets worse, marked by this really disturbing stiffness. It feels like a fight. It just can't win. This isn't just a random scene. It's often the first really heartbreaking glimpse of something called Lavender Foal Syndrome. The name itself, it sort of hints at something unique, but also, tragically, a very difficult story. Today on The Deep Dive, our mission is to really try and understand this rare, devastating genetic disorder. It mainly hits a very specific, cherished horse breed, the Egyptian Arabian. We really dug into the research, comprehensive veterinary and genetic sources to uncover the precise genetics behind it, the surprising range of clinical signs, how it's diagnosed, and maybe most importantly, how this heartbreaking condition can actually be prevented.
That's absolutely right. The sources we looked at give a really thorough understanding of Lavender Foal Syndrome, or LFS. They take us from the very basics of what it is, through all the complex details, and all the way to those critical prevention strategies that are available now. It's a complete picture, really.
Okay, so let's start unpacking this then. What exactly is Lavender Foal Syndrome, LFS, at its core?
Okay, so at its heart, LFS is what we call a coat color dilution lethal. And it's also a tetanic neurologic syndrome, which basically means it causes severe, kind of sustained muscle rigidity and major neurological problems in newborn foals. It's rare, thankfully, but devastatingly, it's always fatal for the foals that are affected. And it has a clear genetic cause. Specifically, it's inherited in an autosomal recessive way. What's really crucial to understand is the specific signalment who gets it. It pretty much exclusively affects foals that are pure Egyptian Arabian. And the signs show up immediately, or, within just hours of birth. We just don't see reported cases in other breeds, and it affects males and females equally.
That name, Lavender Foal Syndrome, it's so striking. Is that specific coat color always there? What makes it stand out?
Yeah, the dilute coat color is definitely a key feature. It's often described as that silver gray, which gives it the lavender name. But interestingly, it can also look like a dilute chestnut or maybe a pale slate gray. So it's important to know that affected foals aren't always that classic lavender color, but that coat dilution, that paleness, is consistently there and quite distinct.
Right, so connecting those pieces, how can one single genetic defect cause both this unique coat color and these incredibly severe neurological problems? It seems like such different effects.
That's really the fascinating part, biologically speaking. The cause is a single point mutation. Essentially, it's a tiny error, a single base deletion, just one letter missing in the genetic code in a gene called MYO5A. Now, this gene, MYO5A, it codes for a protein called myosin-Va. You can kind of think of myosin-Va as like a little motor or a transport truck inside the cells. It's vital for moving things around within the cell along these internal pathways. The mutation means the protein that gets made is cut short, it's truncated, and basically non-functional. It can't do its job.
Okay.
And here's the crucial link. This one protein, myosin-Va, is really important in two specific types of cells. First, melanocytes, those are the pigment-producing cells. When myosin-Va doesn't work right there, you get the coat color dilution.
Ah, okay. That makes sense for the color.
Exactly. And second, it's also critical in neurons, the nerve cells. So when it's dysfunctional in neurons, that's what leads to the severe neurological abnormalities, the seizures, the rigidity, everything we see.
Wow. So one tiny error, two huge impacts.
Precisely. And this leads us to the idea of carriers. Horses that have just one copy of this mutated gene, they're carriers. They look completely normal, show absolutely no signs themselves, but they can pass that mutated gene on to their foals.
Right, hidden risk.
Exactly.
Yeah.
So if you breed two carriers together, two horses that each have one copy, there's a 25% chance, a 1 in 4 chance with each pregnancy, that the foal will inherit two copies of the bad gene. And that foal will be affected with LFS.
Okay.
There's also a 50% chance they'll produce another carrier foal, like the parents, and a 25% chance the foal will be completely clear, non-carrier, non-affected.
And you mentioned a carrier rate. How common is it?
Yeah, studies have shown the carrier prevalence can be surprisingly high in some Egyptian Arabian populations. Figures like 10.3% have been reported.
Wow, 1 in 10.
Roughly, yeah. Which means for breeders, it's not just about preventing, one tragic foal, but it's really a bigger picture thing for the health of the breed line.
Okay, so beyond that distinct color, what are the specific neurological signs? You mentioned stiffness, seizures. When do they really show up?
Well, the severe neurological signs are usually obvious right at birth or certainly within the first 2 hours. You see this persistent seizure-like activity, often with really pronounced extensor rigidity. Their legs are stiff and straight out. And opisthotonos, that's the term for that dramatic arching backward of the head, neck, and spine. It looks very unnatural and distressing.
Gosh.
Frequent paddling movements with their legs are also really common. And these foals, they just can't stand, they usually can't even stay upright on their chest, what we call sternal recumbency. They're often just lying flat out on their side. Other things you might see are nystagmus, those involuntary sort of jerky eye movements, and they often seem blind.
That sounds absolutely devastating to witness.
It really is, and there's a particularly poignant detail. Affected foals often still have a strong suckle reflex instinctively, but because of all the neurological problems, they physically can't coordinate themselves to actually nurse from the mare.
Oh, that's heartbreaking.
It truly is. Another point, sometimes these affected foals are actually larger than average at birth, and this can sometimes lead to a difficult birth, what vets call dystocia. But it's important to remember the difficult birth is a result of the foal's condition, not the cause of LFS itself.
So putting this all together, a vet sees a newborn foal, maybe an Egyptian Arabian, with these signs. How do they start figuring out what's going on, especially since other serious conditions in newborns can look similar?
That's a really key question. And one of the first helpful things is actually routine blood work. Things like a CBC, a complete blood count, or a chemistry panel. These are typically unremarkable, basically normal in LFS foals.
Normal. That seems counterintuitive with such severe signs.
It does, but it's a really important clue. It helps differentiate LFS from something like, say, neonatal septicemia, severe infection, or neonatal encephalopathy, sometimes called dummy foal syndrome. In those conditions, you'd usually expect to see significant abnormalities in the blood tests, or perhaps the foal was normal at birth and signs developed later, which isn't the case with LFS.
Okay.
Now, if the LFS foal hasn't been able to nurse properly because of its condition, you might see low levels of antibodies, immunoglobulin G, in its blood serum. But that's a secondary finding, due to the failure of passive transfer, not a direct marker for LFS itself.
Okay, so the signs are severe. They appear right away, especially in this breed. How quickly can they get to a definitive diagnosis? What are the steps?
Well, the clinical diagnosis, meaning based on the signs, often comes together pretty quickly. It really relies on recognizing that characteristic picture in the right breed, an Arabian, especially Egyptian lines. And it's often based on that classic triad of signs we talked about. The dilute coat color, the severe neurological problems right from birth, and crucially, that normal routine blood work.
So when a vet sees that combination, LFS jumps pretty high on the list.
Absolutely. But they're still doing what's called a differential diagnosis, ruling out other possibilities. They need to be sure it's not, say, neonatal maladjustment syndrome, the dummy foals. But those foals are typically born normal, and the signs develop hours or days later, plus they have normal coat color.
Okay, different timeline.
Right, or neonatal septicemia or meningitis and infection. Those foals are often weak, might have a fever, definitely abnormal blood work, and again, normal coat color.
Makes sense.
There's also idiopathic epilepsy of Arabian foals, but those seizures usually start later, like 1 to 6 months old, and the foals are normal between episodes, no coat issue. And things like physical malformations, say occipital atlantocoaxial malformation or hydrocephalus, those would need imaging like x-rays to diagnose, which wouldn't show anything specific for LFS.
Gotcha. What about cerebellar abiotrophy? That's another one in Arabians, isn't it?
It is, but again, the timing and signs are different. Cerebellar abiotrophy signs like ataxia and head tremors usually develop later, maybe 6 weeks to 4 months old, and there's no coat color dilution.
So while the clinical picture is pretty strong, it sounds like there's a way to be absolutely certain. What's the definitive test, and why is this so important?
Yes, absolutely. The definitive diagnosis, the gold standard, is genetic testing. There's a DNA test available that looks specifically for that single base dilution in the MYO5A gene we talked about earlier. It's highly accurate.
And how do they get the sample for that?
It's usually quite easy. Samples are typically either hair follicles, you need to pull hairs that have the roots attached, or just a standard blood sample. The lab then analyzes the DNA, and the results tell you exactly what the horse's genetic status is. It'll come back as NN for clear, meaning the horse has 2 normal copies of the gene, or NLFS for a carrier, 1 normal copy, 1 mutated copy. These horses are clinically normal, remember? Or sadly, LFS for an affected foal, meaning it has 2 copies of the mutated gene.
Okay. crystal clear results.
Exactly. And this genetic test is just vital. Obviously, it confirms the diagnosis in a sick foal, which is important for the owner to understand what's happening. But arguably, it's even more critical for identifying those carrier horses before they're ever bred.
Right, for the prevention side.
Precisely. I should mention, you can do histopathology on a skin biopsy, look under a microscope. You might see things like melanin clumping, where the pigment clumps up abnormally, or follicular dysplasia, abnormal hair follicle development. But really, that's not the primary way to diagnose it anymore. The genetic test is faster, easier, and definitive.
This all just sounds so incredibly tough for everyone involved. Is there any effective treatment at all? Any hope for these poor foals?
That's the hardest part of this conversation, really. Unfortunately and unequivocally, there is no effective treatment or cure for Lavender Foal Syndrome. The neurological damage caused by the faulty myosin V protein is just too severe, it's progressive, and sadly, completely untreatable.
So supportive care doesn't help.
Well, you can provide supportive care, things like, bottle feeding because they can't nurse, or maybe giving anticonvulsant drugs to try and manage the seizures, and that might keep the foal alive for a short period, maybe a few days. But, and this is critical, it does absolutely nothing to change the underlying disease process. The foal will not get better. So the prognosis is, frankly, grave. Affected foals invariably die, or they are humanely euthanized, usually very shortly after birth hours or maybe days. This is because the neurological problems are just so severe and debilitating they can't stand, they can't nurse, they often have uncontrollable seizures. Prolonging their life really only prolongs suffering, and it's generally not recommended.
That's just incredibly sad. So this really brings up a critical point then. If there's absolutely no treatment, prevention has to be everything. It's the cornerstone for managing this, right? What are the absolute key strategies?
You've hit the nail on the head. Prevention is not just important, it's the only way to control LFS. It relies entirely on genetic screening and making responsible breeding choices. The number one key action is genetic testing of all breeding stock, full stop. Any Arabian horse that might be used for breeding, especially if it has Egyptian bloodlines, or even if its lineage isn't fully known, really should be DNA tested to find out its LFS carrier status. And in NLFS, or theoretically LFS, though affected foals don't survive to breed.
Okay, test everyone intended for breeding. What's next?
The fundamental rule, the core principle of prevention, is simple. Avoid carrier-to-carrier matings. You just never breed two NLFS horses together. Because if you do, you run that 25% risk with every single foal of producing an affected LFS foal.
So does that mean carriers shouldn't be bred at all?
No, not necessarily, and this is a really important clarification. LFS carriers, the NLFS horses, can actually be bred safely if they are bred to a horse that is tested clear, meaning an NN horse.
Ah, okay.
In that specific mating, a carrier, an LFS, to a clear NN, you will never produce an affected LFS foal. That's guaranteed.
Right, because the foal can't get two copies of the bad gene.
Exactly. Now, what will happen in that cross is that on average, 50% of the offspring will themselves be carriers, NLFS, inheriting the gene from the carrier parent. And the other 50% will be clear, NN. So you're not creating affected foals, but you might be creating more carriers.
Which means testing the next generation is still important?
Absolutely. It's an ongoing process. And transparency is key, too. For example, the Arabian Horse Association's Code of Ethics often requires breeders to disclose known genetic defect carrier statuses, including LFS, so breeders can use these test results, NN or NLFS, to make really informed decisions. They can choose matings that avoid risk, and over time, this collective effort can actually reduce how common the LFS gene is within the whole Egyptian-Arabian population.
So it's about individual choices having a larger impact on the breed's future health.
Precisely. It's moving from reacting to tragedy to proactively safeguarding the breed using the power of genetics.
Okay, so just to recap our deep dive here, Lavender Foal Syndrome is, well, it's a truly tragic, fatal genetic disorder. It leaves this indelible, heartbreaking mark on the affected foals and, of course, their owners and breeders.
Yeah, it really does. But, and this is the hopeful note to end on, while there's no cure, the fact that we have this definitive DNA test for identifying carriers completely changes the game. It really moves the situation from one of, helplessness when a foal is born affected to one of genuine empowerment for breeders. Prevention is not just possible, it's achievable and absolutely crucial for the health of the breed.
It really is remarkable when you step back and think about it, isn't it? How our growing understanding of these specific genetic mutations, like this tiny deletion in the MYO5A gene, how it not only lets us identify and prevent truly devastating diseases like this in animals, but it also gives us this much deeper appreciation for just how intricate life is, how these individual proteins play such fundamental roles in, well, all living things. It really makes you wonder, what other hidden genetic risks might just be out there waiting for us to uncover and understand?